Dr. Thomas, the founder of Mobility Clinic, and today we're here with Brent. How's it going, Brent?
Good.
Good friend, good buddy from college.
Yes, sir.
Kentucky proud.
There it is.
So this is our second time seeing Brent, correct?
Yep.
And what have you been working on?
My ankle, sprained it 14 years ago when I was 20. We think that that's affected over the last 8 years my knee and my lower back. Been sitting in a chair primarily doing computer work for the last 10, 11 years. And
Desk jockey.
and then my right shoulder primarily just been playing baseball since I was 4. Stopped playing that about 8 years ago, but transitioned to dodgeball that I've been playing the last 8 years.
Yep. So a lot of hard throwing on those balls, right?
Yeah.
So with the ankle sprain, he had a really bad inversion sprain that basically put him out for a little while. Never got it X-rayed, never got it imaged. So basically like a grade 2-3 sprain that we've been working on. How's it been feeling after your first treatment?
You improved it quite a bit. It was a week ago last Monday, and then you gave me exercises to do, and I've been doing those every day for about 15 minutes. Yeah. It's felt better than it has in years, so I'm really excited about what hopefully you can do right now and continuing to do these exercises every day.
Perfect. So what started first? The ankle, right? And then what happened second? The knee?
It definitely was the ankle, and you believe.
Then you started to get knee pain, right?
Yeah, 8 years ago.
The low back kind of started bothering you on the right side. So he's definitely got a kinetic chain.
The knee and the lower back happened around the same time, maybe 2010, 11.
Exactly.
Yeah.
Exactly. Okay, cool. So what we're going to do is we're going to start at the low back and kind of work our way down. So let's look at your range of motion first. So stand up for me.
Okay.
We're just going to go ahead and bend down and touch your toes. Wait. Tightness?
Yeah, that's about it.
Where do you feel all the tightness in the back of the knee?
Well, when I stretch, it stretches a lot behind the knee.
And where do you feel the knee pain most of the time?
The knee pain's right here.
On the outside of the lateral.
Yeah.
I mean, you're doing a lot of exercise and running, things like that. Okay.
Yeah.
Let's go put your hands on your low back and extend back for me. Got any pain or tightness to that? Pretty good.
That's not bad.
Have a seat for me on the table. Seated. Just a seat. There you go. Cross your arms over your chest. So what we're going to do is just kind of look at your trunk range of motion into your lumbar spine. Let's rotate right, rotate left. Any pain or tightness with any of these, you let me know.
No, it's pretty good on that.
Right laterally flex, left laterally flex. Any issues there?
Mm-mm.
Okay, awesome. So you say you're having right shoulder pain too, huh?
That's just from throwing dodgeball a lot, but yeah,
shoulders.
It's chronic.
Relax your arms. So just going to kind of palpate around. Tender there, huh?
Yeah. Not so much on the left side.
Okay. So a lot of times with baseball players, Major League Baseball players, dodgeball players especially, we get mechanic breakdown of the scapula. So we're going to do a couple muscle tests and test that out. Okay, Brett?
Okay.
Go thumb out like you're hitchhiking. Hold right here. Don't let me push you down. Hold. I'll go thumb down for me. Hold. Do you feel like click
I can
in
even
your
feel
shoulder?
click. Yeah, I heard it and I could feel it.
Hold.
Yep.
And he's a pretty fit, strong guy. So go left side. Thumb out. Hold. Now go thumb down. Hold. Good. And relax. So you see that difference there?
Yeah.
And that breakdown?
Ooh.
Okay.
Oh, that's pain.
I'm going to do a couple of orthopedic tests here. Relax on my...
Okay.
We're going to extend you back. Any issue with that?
It's a little painful,
Tight.
yeah.
Where do you feel the tightness in your pec? Or?
It's like back. No, it's just it's my shoulder. It's right there is where the pain is.
Okay,
Pecs are fine.
here. We're
yeah.
Bring you forward. Any issue with that?
A little bit, not bad though.
All kind of grabby. Okay. Let's go palm up like this right in front of you.
Okay.
I want you to raise your hand all the way up into flexion. So start low.
Okay.
Bring it up.
Okay.
Into resistance. Tough to do.
Yeah.
Let's do the other side. Bring it up. Good. Now fight each other. All right. So we're getting a little bit of scapular breakdown. So we're going to work on that today up to your neck. Look at your rotators of your rotator cuff.
Okay.
So what we're going to have you do is hold your elbows down at your side.
Okay.
And we're going to test internal, external rotation against my resistance.
Okay.
So you can go internal, go. Good, now go, keep the elbow at your side.
Okay.
Now go external. See the difference?
Yeah.
External rotators. Let's do the left, hold, resist, hold. Can't even budge you.
Yeah.
Bring you in. Good. So, definitely a little bit of scapular kind of things breaking down there. Go on your back, face up. We'll do one more test on your shoulder, and then we're going to work our way down. Okay, we're going to do arm fossa test. We're going to hold your arm straight up here.
Okay.
Don't let me push you that way. Ready? I'm going to push you down.
Gotcha, okay.
Hold. Other side. Hold. Hold. Other side. I'm going to show you the difference. See? Hold. See, now this is his non-dominant hand, and you have way more strength on that side, right?
Yeah, I'm right-handed.
That's your throwing arm, so
Yeah.
you're getting that constant repetitive motion from
Yeah.
overhead throw. So we're going to get into that. Let's go ahead and get into your ankle. All right, so you got to kind of point to where you feel it and where you're stressing it out.
Okay. It's basically like right there.
Right on his lateral ankle, right around his kind of what we call the anterior talofibular ligament. A lot of times with inversion sprains or strains, that will get basically pulled apart, and you kind of get some scar tissue as it grows back.
Do you want to show them on the little chart real quick?
Sure. So over here, we have a better view. So in Brent's mechanics and things like that, here are our lateral ankle ligaments. So we have 3 on the lateral side, 4 on the inside, which is our deltoid ligament. For him, he had such a bad sprain that he basically did this calcaneofibular, and his anterior talofibular ligament is just rigid, solid, and painful to the touch. Now when that's all lit up, you basically don't get that saddle joint kind of glide of where the talus sits between the fibula and the tibia. So we got to get that motion back in his mobility of his ankle. So I'm going to push a couple places. Tell me if it's pain or tightness, okay?
Okay.
Tender?
A little bit of pain, but way better than
Way better
last
than
Monday.
last week.
Yeah.
You were jumping on that, huh?
Yeah, I couldn't handle it.
How about right there?
That's where you did it. Yeah, that's a little more pain.
Right there.
Yeah.
So when I run my hands across his ligament, it's just, I can feel that kind of
Yeah.
like little pebbles in there. Huh?
I've been feeling it. I've been doing the same thing on my left ankle every day this week, and I can literally feel like the scar tissue and everything in my right ankle now that I'm.
So you've been kind of rubbing the area.
I've been
you can
rubbing
feel
in
the
there,
difference.
digging in with my thumb. Yeah, just kind of doing deep tissue massage myself.
So after a chronic ankle sprain not long ago and not getting actual
Yeah.
treatment, that scar tissue just builds up
Yep.
over time, and it's not gotten better.
I should have worked on it for years and done preventative medicine rather than waiting this long for it to get bad.
Healthcare, not sick care. Right?
Exactly. Yeah.
Awesome. So we're just doing a couple tests, anterior, posterior jaw, see if there's any instability. Not too bad. Put you down that way. Any pain?
It's much better.
Put you down that way.
Now
any
that's
pain?
the pain. Yeah. Yeah.
Right there, right? Because
Yeah.
that's his talus joint. So
Yeah,
basically he's getting
Exactly right.
rigidity.
That's where the pain is right there.
So when I work on ankles, I like to work up into all of the tib fib area, because all the muscles come down and attach down here on the foot.
And when I sprained it when I was 20, it was a 3rd-degree ankle sprain. It was literally black and blue up to there and down to my toes. I couldn't believe it. I didn't understand. Like, why is it black and blue?
Swells up really big.
It was swollen. It was so big. I couldn't put on shoes. I was on
I
crutches.
remember that in college, yeah. Basketball, right?
It was so bad. It hurts so bad.
Okay, let's point your toes up and out for me.
Okay.
Hold. Straight up for me. Hold. Straight down for me. Hold. So that's nice and stable. We got a little pop there,
Mhm.
but nothing too bad. All right. So we're going to look at his knee here and just do some orthopedic tests. So nice and relax. Relax the knee. Is there any way to skinny
Yeah, I
jeans?
think it will stretch up a little bit.
There we go. That's a good thing about skinny jeans. Okay, so we're just going to do a little orthopedic test on his knee. So his ACL looks pretty good there. PCL, nice and stable on his lateral. And his basically like T-band right here. Is that tender?
Yeah.
Is that rigidity?
Yeah, that was pain on the very end.
Okay, I'm going to push on a spot. We're going to bring it out. Discomfort with that?
Not really.
Okay. So we're just doing some orthopedic tests, see if anything's kind of lit up. I'm going to push you here. Test your meniscus. Discomfort.
Mm-mm.
But not this way.
It's just that's actually my big toe is a little sore. Yeah. Yeah.
How about that? You
Mm-mm.
okay there?
No.
Okay, so let's flip over on your belly face down.
Okay.
So this is whole right kinetic chain, whole right side, even going up to his shoulder. We're just going to do a full body kind of treatment and adjustment, and especially these areas of complaint. Scoot down towards me a little bit, Brent. Right there. So once you push out against my hands with your legs,
Okay.
and pull in with your legs. Good. So we're just using that to reset his pelvis. And if you come on over here, we can basically see his leg length inequality. So he's got about anywhere from a quarter, maybe 5/8 of an inch there of a leg length difference. You can see how this foot's kind of cranked out a little bit more too. So it's definitely coming
Oh,
from.
and I looked at the bottom of my shoes like you told me last week, and you were right about where
The
my
wear?
shoes wearing on the
Yeah.
bottom of my shoes.
So Brent's basically a pronation gait, which means that he's got that lateral outside shoe wear, and he's getting a little bit arch breakdown in his arch, which is translating up his entire chain. So we're going to kind of work on that as we get along, and as he's get out of pain, we can kind of address the cause of the symptoms and go from there. Okay. So a little bit decreased pain range of motion there. If you look too, as he's laying flat, you can kind of see he's rotated the opposite direction. He's kind of cranked back this way. So that's probably why his leg's shorter, why he's getting that that knee pain from his non-mobility in his ankle. So we're going to work on everything, okay, Brent? We're going to start on the shoulder. We're going to do a little electrical stimulation and some other tools and devices.
Okay.
We're going to do your low back and then all the way down into your ankle, okay? Stand up for me and take your shirt off. All right.
She's a good girl.
All right, Brent, let's get you on your belly face down.
Okay.
We're going to basically work up into the shoulder, get some ranges of motion going, and we're going to give you a full body adjustment, okay?
Perfect.
So first one we're going to do is up into your shoulder. We're going to use what we call Mark Pro, which is really great at pumping out lactic acid and kind of waste products. Because what we're getting is kind of breakdown of your scapula here in your shoulder. All right, so we just got Brent hooked up to all the toys. We got him on some SOT blocks for his pelvic rotation. We have some electrical stim units, neuromuscular stimulation going on in his ankle and his low back and into his glute, with some ice on his ankle and some heat on his upper neck. So we're going to leave him on here for about 10 minutes, check back in, and then get started once everything's kind of relaxed and loosened up, okay? All right, so Brent's done here. We did about 10 minutes on the stim and the ice, so we're going to go ahead and get started. I'm going to pull all the pads off because we've got them all hooked up. Get him moving better and feeling better. So as you can see, he's kind of red here from the heat, nice and warmed up. I'm going to turn that off there. So on this one, I put it on that spot that he was really sore right there. Can you feel that?
Oh, yeah.
Yeah. So his levator scapulae is that specific muscle. Turn this one off. And again, we use an interferential current. It's basically about 80 to 122 mega amps or millihertz to basically loosen everything up and fatigue his muscles. Take out our blocks. And perfect. So we're going to go ahead and get started here, Brent. I want you to come on up and have a seat on your butt for me on the table. So first thing we're going to use is start on his shoulder, really bright.
Oh, I've just been eyes closed the last 10 minutes.
So what we're going to do first is work on his shoulder. We're going to adjust his shoulder, retest everything afterwards, and we're going to work our way down. So first thing we're going to do, Brent, I'm going to show you a motion of how the scapula moves. 17 muscles attached to this bone alone, and it pulls it up, down, in, out, all different directions. So we're going to have you do an active range of motion exercise, or basically movement, as we treat you. Okay. First one, you're going to come up this way.
Okay.
So nice and tall with your neck. We're going to start here. You're going to come down across your chest.
Okay.
Grab your elbow with the other hand and give it a pull down towards the floor. That's it. Come on back up. You're going to keep just repeating that. Ready?
Okay.
Go.
Do I pull it when I get down here? Okay.
Breathe through it. Go. So we're just working into his rhomboids, up into his levator and his trap. Trapezius muscle, where a lot of these muscles overlap. Causing some restriction and pain, right? It's a little tender there.
And what is that delicious smelling lubricant you have on it?
So that's the lubricant we're using is actually a topical analgesic cream called China Gel. And what it does is it basically has a lot of natural kind of not too stinky as like other analgesics, but gets into the skin and loosens things up. Arm out to the side here. When I say go, you're going to bring 180 degrees across, elbow pull. Okay, just like a rhomboid stretch.
Okay.
So this one we're going to get down into his rhomboids here.
Oh, wow.
And you can hear that grittiness in there because of all those muscles. Two more. Breathe. Last one. Go. Good. So see, he gets a little bit of a petechial reaction because we are using instrument assisted. We're basically causing micro traumas to stimulate the healing process. That's kind of the technique. Now, we're going to do myofascial release technique, same motions, but we're going to use our hands instead of a tool. So, nice and relaxed, arm up this way, back down across the chest. Ready? Go. Breathe, elbow, pull.
Oh, God.
Up again. Oh, you're gonna go up and down.
Okay.
Yeah. Kind of like the disco. Good.
Oh, wow. Ah.
One more. You got it. So it's not necessarily a fun treatment. Okay.
That's
Now we're going to come out to the side, 180 degrees across. Go.
Okay. Oh, that feels like nothing compared to the last one.
Yeah. So basically having a little bit of what we call a sick scapular dyskinesis. Go. Back again. You never dislocated your shoulder.
Nope.
You never had any bad trauma.
Not to my knowledge.
Go ahead and relax.
No.
Good job. Go ahead and put your shirt back on. We're going to start working down into your knee and ankles. All right, so now what we're going to do is work onto your lateral ankle here on your ATFL ligament, the anterior talofibular ligament, and this is what we're going to use, some China gel. That's a topical analgesic. First thing we're going to do is work up into here, so you're just going to relax, and we're going to get right on that lateral ankle where all that restriction is. And kind of work your way in with some passive range of motion. Tender.
Yeah.
Gritty. Now, when you run the tool over the tissue, you can really feel just a rigidity in the tissue and click, 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 kind of a scar tissue formation that we got to get broken up. Okay, now, Brett, what I want you to do is point your toe up and out, down and in for me. Go. Up and out, down and in. That's much better than last week, huh?
Yeah, it is.
Up and out, down and in. Still a little tender.
Yeah.
Good. Now we're going to work up into his tibialis anterior, which comes down and crosses over his ankle. So come up and out, down and in. So we're basically activating the muscle, up and out. Watch it fire right there, down and in, up and out, down and in, and one more. Good. Down and in. Excellent. Okay. Now, since it was inversion sprain, we're going to get on his calcaneotalar ligament, and we're just going to get on the lateral side of the ankle, but not near as bad there.
No, it's not.
Good.
It's still no walk in the park, but that's not as bad.
Okay. Great. So, now what we're going to do is we're going to adjust his ankle and his talus joint here, his talar joint. So how we're going to do that is we're just going to nice and relax all the way, Brent. Nice and jello. And we'll give you a nice pull.
Ooh, I could feel that. Yep.
Okay, nice and relax here. Now what we're going to do is parts of his feet that make his arch into his cuboid, navicular, and into his metatarsal heads here. So we're adjusting his kind of whole extremity here. So nice and relax. Pressure. Good. We go on the calcaneus here. Like pull one more. Nice and relaxed. Good. And then into the empty heads. So you said you're having big toe pain?
Yeah, like both my toes, this one and that one. If you look, see how I'm pulling my feet back? Look at my big toe, specifically the left one. It just can't come back. But look, I can move it.
Yeah.
So I've stubbed those toes so many times playing like sand volleyball and stuff. I mean, I've never gotten an x-ray. It's possible I could have broken them or something. I have no idea.
Quick look at that. So it's just, go ahead and extend your toe again. Yeah, so you can't even get extension.
You can push it with your thumb.
So resist me. Hold.
Oh, yeah, it's painful too.
Resist. Hold. Yeah, so it's kind of his extensor hallucis longus. So we're going to address that too. So again, we use a little China gel. And we're going to work into the extensors.
Oh, that's really painful.
Tell me if it's too much. You can move it. Just getting on his dip and his pip joint, distal interphalangeal joint. And his pip joint, proximal interphalangeal joint, and kind of just loosening that chain up. Go ahead and extend your big toe. Flex your finger. Okay, relax back down. Back up. Back down. Go back up. Back down. It's kind of like sand toe or turf toe.
Yeah.
You hyperflex it. Back down.
Oh, okay. Okay, alright. That's pretty painful.
Alright, nice and relax. We're just going to work our way up that extensor. Good. Nice and relax up the toe. Let's get that change off so you get some grip. Okay. Any pain with that?
A little bit, yeah.
Yeah.
Not too bad.
We're just going to do a little light traction on your big toe. Nice and relax that talus. Good.
could feel
Okay,
that
go ahead and
first
extend
one.
the big toe for me. Yeah, so definitely an old injury. You can't get that extension in that
Yeah,
big joint.
it's been like that for years. Yeah.
But, we got to get some motion back in there. So we'll have to continue to kind of work on that.
Okay.
We're going to work on your flexor as well. So go ahead and flex your toe. Flex your toe. Now extend. Back up. Good. Flex. Extend. So again, it's a little myofascial release to the joint. Flexor digitorum. Good. 2 more. 1 more. Take a shortened pin pull range of motion. Myofascial release technique. 1 more. Good. And relax. All right. Let's get up into that knee. We're going to adjust you. We'll retest everything.
All right.
Okay. I'm going to bring you up here. Nice, relaxed knee. Come on out to me. All right. So nice and nice. We're going to get on that IT band on that lateral quad muscle. Breathe through it. Good. Okay. Be a little tender back here.
Okay. Oh yeah.
Nice and relaxed. We're going to get on this popliteus, which is the last little 5-degree ankle or knee extender. Relax here. Good. Doing okay?
Yeah.
1 more. Good. Go and relax that knee all the way. Nice, relax my hand. Nice and gentle. Light pin pull. 1 more. So adjusting his tibia on that internal rotation. Good. All right. So we just adjusted his ankle, knee. Let's go right side up. We're going to adjust his pelvis now. Side posture position. We're going to come up here. Just with this foot, straighten this bottom. Arms going to go over your chest just like that. Tuck your hip forward towards me. Right there. Perfect. So nice deep breath in for me, back. Full exhale out. There it was. Other side, flip on over. Ankle up. Arm over chest. Take
This
your hip
the
forward.
shoulder's a little sore.
You're going to be real sore on the shoulder.
That's
2 or 3 days on the shoulder. Over your chest. Take a nice deep breath in. We're going to be right on this TL junction here. Full exhale. Good. Back face up. Other back. There you go. Okay, give yourself a hug. One arm over the other. Hold there. Chin up to me. Up to me with your chin. Chin to chest. Chin to chest. There you go. Deep breath in. Full exhale. Drop, drop, drop.
Oh,
Good job.
oh, that was like pop, pop, pop.
Now, last thing we're going to do is stand your back. We're going to get into your shoulder. Okay?
Okay.
Just get down towards your feet a little bit. Nice and relax that elbow. So we start on that pec minor. So not only for the scapula do we want to hit the posterior chain, but we also want to hit the anterior structures. Subscapularis, which is one of your rotator cuffs. We're getting into pec minor and major. And getting that. Breathe through it. Good. Relax that elbow nice and easy. We're going to bring it out nice and gentle. Nice and gentle. A little motion in that glenohumeral joint. So we're going to come down. Right, pressure down. 1 more. Good. Put your hand behind your neck. Right behind your neck. There you go.
Okay.
Relax that elbow. Relax that
Yeah.
shoulder. We're going to roll your shoulder forward. Good. Now we're going to get on your 5th rib. Nice and relax here. Jello, deep breath. Full exhale. Relax that whole shoulder. Good. Show me how it's done. Hold. Don't let me push you down. Hold. And I'm shaking. I'm pushing somewhere. Right?
Yeah, yeah.
So let's come on. Swing your legs back around. Let's retest
Okay.
that shoulder. Relax your shoulder first. How's the tenderness now? I mean, it's still a little rigid in there.
It's
huh?
definitely feels better than.
Come out like you're hitchhiking. We'll see how you feel tomorrow.
Yeah.
Hold here. Hold. Thumb down. Hold. And I'm pushing.
Yeah.
Right? So that's basically Brent's treatment for today. We got a little bit more work to do,
Yeah.
but we'll go from there. You have any questions, Brent?